Hello, everyone. Welcome to the webinar, Keep Them Coming Back, Resources for Coaches to Enroll and Retain Participants in the Lifestyle Change Program. Today's objectives are to identify at least one effective communication strategy that can be used in type 2 diabetes prevention or self-management programs. Identify at least one effective education strategy that can be used in type 2 diabetes prevention or self-management programs. Identify at least one evidence-based approach to type 2 diabetes prevention or diabetes self-management that can be used in community or team-based clinical care settings. And describe at least one strategy for reducing diabetes-related health disparities, and describe at least one tool or resource to support the implementation of best practices in improving diabetes education and communication and/or reducing diabetes-related health disparities. Before we get into specific tools for promoting enrollment and retention in the National DPP Lifestyle Change Program, I would like to take a step back and look at the landscape of information and learning resources that are freely available to you. If you're not already familiar with the National DPP Customer Service Center, the acronym is the CSC. The CSC is a one-stop shop for our partners delivering and promoting the National DPP Lifestyle Change Program to access on-demand self-service resources, including videos, research articles, training and outreach materials, and more, to help make preventing or delaying type 2 diabetes easier for your communities. On the homepage, you'll see a How to Get Help section where you can learn about how the CSC can help with program delivery and understand how to navigate the site. Submit a technical assistance support request or take a look at the community discussion board. Additionally, we have a variety of commonly used resources highlighted in the Key Resources section. You can also view resources by clicking on the Resources tab in the navigation bar. This will direct you to all the resources on the CSC grouped by topic. Moving on, I did want to provide a few tips for navigating this site. This is a screenshot of the marketing page. If you were to have clicked on the Marketing and Recruitment of the National DPP topic within the Resources page, you'll get a page that looks like this. The first three indented resource topics are marketing materials, national campaigns, and reaching underserved populations. These are the most popular or commonly searched items for that topic. By clicking on each topic, you'll find a group of resources underneath related to the category. The search bar at the top, where we've added a green arrow, is prominent on almost every page within the site, and it's a very useful function if you have something specific that you're looking to find. By typing in a close approximation of what the actual resource may be labeled, you'll usually find it within the first couple of links. In addition to these resources, the blue boxes on the right can help you find help or answers to questions. You have options to ask the CSC community, contact support by submitting a technical assistance request, or view upcoming events such as the Diabetes Prevention Recognition Program office hours. For technical assistance request, you should get an automated response, and in most instances, you'll get a full-length response from a subject matter expert that's been assigned to respond to that specific topic, usually within 48 hours. The next resource I wanted to talk about is the National DPP website. The National DPP website really serves as the gateway to all audiences interested in information about the National DPP and how to take the next step. This is a great place to refer both people and organizations that have questions about starting or joining the Lifestyle Change Program, and will provide them with an overview and foundational understanding of the program itself and key roles that each person can play. The National DPP website provides a variety of informational resources, including information about the Lifestyle Change Program, such as what prediabetes and type 2 diabetes are, and the benefits of participating in the Lifestyle Change Program. Additionally, this page includes links for participants and program providers to learn more about Lifestyle Change Program details, the Personal Success Tool, the Prevent T2 curriculum and handouts, and more. At the bottom, there are also testimonials from participants, providers, and employers, which share detailed information about what the experience is like to sign up for and participate in the Lifestyle Change Program. If you were to click on the Lifestyle Change Program details box, you would land at our consumer-facing Lifestyle Change Program page, which is designed for potential participants who are at high risk of developing type 2 diabetes. Organizations should familiarize themselves with this page so that they can understand what's here when talking to potential participants that are interested in finding out more information about the Lifestyle Change Program. The Lifestyle Change Program page provides an overview of the Lifestyle Change Program, the curriculum content that the participants will learn through the program, eligibility requirements, participation options, including in-person, online, distance learning, and combination, and the prediabetes risk test for those who are interested in evaluating their risk for prediabetes and type 2 diabetes. We recognize that lifestyle coaches work hard to build and maintain relationships with their participants. So having tools that can help you keep these connections active is essential, especially when you can't be together in person. Your coaching skills and enthusiasm keep participants coming back and encourages them to stick with the program. However, some people drop off and life gets in the way. The National DPP Personal Success Tool, or PST, is designed to be there for participants when you can't be. It helps them renew their commitments and feel encouraged. The PST is a web-based resource for you to use with your participants. Each of the modules reinforces the program content in a timely way. You can send your participants links to the modules one at a time to match the session topics covered in your program. The PST can be accessed on smartphones, iPhone and Android, tablets, or computers. Participants will find encouraging messages and responses tailored for them, as well as quizzes, games, and pledges they can create for themselves. The National DPP Prevent T2 curriculum and handouts page on the CSC provides a list of current participant modules. The curriculum promotes modest weight loss, increased physical activity, and reduction in A1C through a 12-month lifestyle change program, while also reflecting new literature on self-efficacy, physical activity, and diet. The Personal Success Tool, or PST, is an easy-to-use interactive web-based resource to help National DPP lifestyle coaches and program coordinators increase participant retention. This tool can be used to help keep participants engaged and active even when they can't come to in-person sessions. The Lifestyle Coach's Guide is a short overview of the PST, what it is, and when to use it. It also takes you through implementing the PST using the following steps. You can try the PST yourself. Introduce the PST to your participants. Tailor and send text or email prompts with links to new modules as scheduled. And be ready to help participants who use the PST. Consider how your participants may respond to the PST, what questions they may have, and what obstacles you can help them overcome. They have signed up for the Lifestyle Change Program because they want to succeed, and this tool can help participants reach their goals. Your comfort with the PST will make it easier for them to use it. The PST is designed to follow the order of the Prevent T2 curriculum, but you can use it with any CDC-recognized Lifestyle Change Program curriculum. If you use Prevent T2, the quick reference guide shows the order in which you can send each of the PST modules and topics. You do not need to follow the module order listed in this guide, but make sure to send the same topic of the PST modules as the session topic you covered in class. In addition to the coach's guide and scheduling tool, you can find talking points and a participant handout. The PST is designed to offer participants a positive experience, provide tips to support key sessions, and provide information based on evidence and behavioral science principles. Participants like yours helped test and refine the modules. We expect that participants who use the PST may overcome the challenges that cause some participants to drop out. I'd now like to shift focus to a tool aimed at supporting efforts to recruit new participants. Let's talk about ways to spread the word and engage new participants. CDC's new Program Champion Toolkit is here to help you and your lifestyle coaches reach new participants through the power of relationship building and storytelling. The Program Champion strategy was designed to support existing recruitment and outreach activities by using current and past program participants as program champions to help recruit new participants into the Lifestyle Change Program. The Program Champion strategy is based on behavioral research that shows the positive influence of word-of-mouth endorsement from social networks. It recognizes the unique and powerful influence that participants can have on others who may benefit from this program. The Program Champion strategy offers a range of activities, and program champions can choose the ones they're most comfortable with, which meet the program's needs. Finally, the Program Champion strategy is scalable, so regardless of the size of your lifestyle change program or how many staff members or resources you have, this strategy can work for you. Although the Program Champion strategy is intended to increase recruitment and enrollment, some of the information and materials may also help your program retain participants. Let's talk a little bit more about the program champions. What makes someone fit for the program champion role? You need to consider your own program needs and participants in identifying program champions, but the characteristics on this slide can be a good starting point. Program champions should have the following characteristics. They should be excited about the Lifestyle Change Program. They are successful in making lifestyle changes and overcoming barriers. They have a positive attitude about making lifestyle changes. They are good listeners and clear communicators. They should be comfortable talking with people, willing to share their story about the lifestyle change program, and seen as members of the community you serve to help build trust. I hope you're better able to envision who might make a successful program champion in your lifestyle change program. Now let's talk about the resources. Just as with the PST, CDC has created resources to guide you in using the Program Champion strategy. It all begins with the Quick Start Guide. This introductory document describes each step in the Program Champion strategy process, from getting buy-in to supporting program champions throughout the process. Another helpful tool for the program staff is the Program Champion Strategy Pathway. Follow the suggested steps in this pathway to implement the Program Champion strategy. The remaining resources help you identify and approach potential program champions, get them introduced to the Lifestyle Change program, and help them stay engaged. The guidance documents for program champions are designed to help your program champions navigate their new roles. Every participant has a story to tell, from what brought them to the Lifestyle Change program to what the support system looks like. A program champion can help potential participants enroll by sharing their stories in a relatable way. Now that we have shared the PST and Program Champion resources, it's time to look at an example of putting these tools into practice. As an example, I'm going to focus on the Program Champion strategy. While this strategy was designed with in-person programs in mind, it could be adapted for the virtual environment. Let's meet Vanessa. She's been a coach for 3 years and loves the connections she makes with her participants. Her favorite thing about being a coach is when someone has a light bulb moment and takes the concepts discussed in class and turns them into small steps towards reaching goals. For example, I will stand more than I sit in a day. She loves sharing her participants' success stories and engaging with new participants. However, with the current limits on face-to-face activities, she's worried that her outreach and marketing efforts will be limited and her environment will be impacted or her enrollment will be impacted. After seeing other lifestyle coaches share information about the Program Champion strategy on a coach's social media group, Vanessa talks with her program coordinator, and they decide to give it a try. We'll now go through the steps that Vanessa can take to put the Program Champion strategy into action. Vanessa will go through 4 steps to implement the Program Champion strategy. These include 1. Getting familiar with the Program Champion strategy. 2. Identifying possible program champions. 3. Engaging program champions. And 4. Supporting program champions in reaching potential participants. As a first step, Vanessa browses through the resources and guidance documents in the Program Staff section of the Program Champion Toolkit webpage. This page has information on how to identify program champions, the different parts of the Program Champion strategy, how to guide her program champions, and more. She also looks through some of the resources that are designed for the program champions to understand what being a program champion would mean for her participants. Vanessa then asked all of her participants to send her an email of what they've learned from the Lifestyle Change program so far. For example, this includes how they've benefited, what changes they've made, and how they feel now compared to when they started. This information will help her identify participants who communicate well and have a positive story to tell. When asking for emails or letters from participants, it's important not to mention that you're looking for program champions there, because you don't want participants to feel pressured when sharing their experiences, or to be disappointed if they were not selected. You can then reach out to them individually to contact potential program champions. Based on the responses from participants and the size of her program, Vanessa decides that she only needs one program champion for now. But the number can vary based on the size and available resources of each program. Once she chooses the program champion, Vanessa reaches out by email and sets up a time for a video call. When the program champion asks for more information about the role, Vanessa sends her some of the resources from the guidance documents for Program Champions section. Next, Vanessa will move to step 4. Once the program champion is onboarded, Vanessa takes the time to go through some of the tips and tools for program champions with her volunteer. They also brainstorm ways they can reach out, both virtually and in person, to potential participants in the community. Hopefully, this provides a helpful example of how you can start using the program champion strategy. In this next section, we'll look at some resources that can help support individuals who are not ready or eligible for the Lifestyle Change Program. The reality is that not all people with prediabetes will be ready or willing to sign up for a year-long program when they first learn that they're at risk for type 2 diabetes. With this in mind, we designed a resource called On Your Way to Preventing Type 2 Diabetes to help people who may not be ready to join the Lifestyle Change Program or who are waiting for a class to begin to start taking small steps toward making healthy lifestyle changes. The guide uses behavioral science-based strategies to increase self-efficacy among people at risk for type 2 diabetes, including meeting them where they are, helping them to make a plan to add healthy lifestyle changes to their routines, and using positive, encouraging messaging to show them that they can take steps now to improve their health. The guide includes sections on helping people assess their current eating and physical activity habits, setting a nutrition plan and fitness goal, tracking their progress, and finding support to help them stick with their new healthy habits. This guide also encourages them to talk about their type 2 diabetes risk with a healthcare provider and to join the National DPP Lifestyle Change Program when they're ready. It also contains tips that you may find useful to share within your own lifestyle change program. You can find the guide using the link on the slide, and the webpage also contains a PDF of the content that you can hand out to people who may not be ready to join your program to keep them engaged in type 2 diabetes prevention. While the goal of the Lifestyle Change Program is to prevent type 2 diabetes, we know that participants and/or their family members can find themselves in the stressful situation of receiving a type 2 diabetes diagnosis. At that point, it will be important for you to connect them with the Diabetes Self-Management Education and Support, or DSMES, services. DSMES services are designed to empower people to successfully manage their diabetes so that they can live a healthy life and reduce the risk of complications. The services are provided by trusted diabetes care and education specialists who can provide ongoing, personalized support to the person with diabetes. Topics covered include how to successfully incorporate diabetes self-care behaviors into daily life. If someone has been newly diagnosed, or if a participant tells you about a type 2 diabetes diagnosis of a family member, you can 1. Encourage them to talk to their healthcare provider about a referral to an individual or organization offering DSMES in their area, or 2. Refer them to the online locator tool on either the American Diabetes Association or Association of Diabetes Care and Education Specialist websites. CDC has many resources to learn about DSMES, including a toolkit, recorded webinars, and links to the national standards for DSMES. We encourage you to visit these resources so that you're familiar with them and can point participants in the right direction. Thank you for your time today. If you have questions about delivering the Lifestyle Change Program, please visit the website for the National DPP CSC. You can access training materials, toolkits, and videos, ask questions, and receive technical assistance related to all aspects of the program.